The state wants to find out how many children are at a healthy weight and how many are overweight or even obese.
The Department of Health is conducting a study of third graders around the state. But Call 6 investigator Kara Kinney found out they are not sharing the results with key people like the child's parents. Kara?
That's right, Erica and Todd. The State Department of Health says childhood obesity costs all of us, and we need to talk about the issue. So we wanted to find out why the state is not sharing a lot of details about the BMI study they conducted.
You're going to go over to the buckets.
It's 9 a.m. at Van Buren Elementary in Brown County.
Now you're going to be rolling the ball back and forth.
Physical education teacher Jordan Webb is leading third graders through a slew of exercises. 8-year-old Allison Pennington says it's not just about health, it's about having a ball.
It's fun.
Allison is one of nearly 1,500 third graders statewide who took part in a BMI study in which height and weight were measured. Some of her classmates also took part, but their PE teacher never saw those results.
They know that information, then we can set goals and work to achieve those goals.
The state conducted the study in tandem with an oral health screening. Parents got these letters about their child's oral health, but the state did not include height and weight results. Surprising, according to Allison's mom, Pamela.
I was just curious why they didn't, but I figured it went wherever it needed to go.
The data from 59 elementary schools is now here at the Indiana State Department of Health.
Childhood obesity and adult obesity are serious issues that we face in Indiana and on a national level. So you have to be able to talk about it.
So why not share test results with the child's parents?
Really, we tried our best to frame the study in a way that would reduce any negative impact on the students who agreed to participate, because we certainly don't want that.
Florida health officials took serious flack after sending home so-called fat letters after a BMI screening.
This whole thing is stupid. It can hurt people. It can break their courage.
Controversy Indiana wants to avoid.
With that sensitivity to weight especially in mind, we decided that it would be best just to not provide the height and weight information.
40 schools declined to participate in the study, in part because many parents did not want their child's height and weight measured.
It is a touchy subject.
The state is thankful for schools like Van Buren that did participate.
We've never had our BMI rates for this third grade population in the past, so we hope that by getting this information we'll be able to help create better preventative services, shape programs, work with schools better, more efficiently, to really help decrease childhood obesity across the state.
Allison's mom and her PE teacher are all for anything to make Hoosier kids healthier.
I think that students need as much physical activity as they can get in a day.
I'm not the skinniest mom in the world, but I want to try and teach my children how to be healthy, what they need to do to stay fit, and activity is key.
Hoosiers pay $3.5 billion a year in obesity-related medical costs, and the state says that makes children's health a concern for all of us.
And the state says if a child wanted to know their height and weight, they would receive it on a post note like this one, and we're encouraged not to share that information with other students.
Any word on when the results of the study will be released to the public?
Well, it's going to come out in about a month, and it will not identify which schools participated, which children participated, and the state hopes to do another one in about another 5 years.
And so always room to improve, huh?
Absolutely. We found a lot of interesting things, including the state has no minimum minute requirement for PE. So we found some schools have a little bit of physical education and some have a lot. And as you saw in that video, the kids love it. They love getting active. So very interesting stuff.
All right. Thank you, Kara.